Ladies and gentlemen, my medical career spanned 4 continents. The last time I witnessed people dying because of lack of primary care was in Africa. That particular government tried its best, but with citizens averaging earnings of less than $1,000 a year, it could do no more. By contrast, here, in one of the world's wealthiest nations, our provincial government's policies have led to the disintegration of our primary family medical care system. I will now describe the real life and death consequences of this travesty. Now, we're all well aware of the excruciating difficulties or impossibilities connecting with a doctor. But these issues are very difficult to actually quantify in a scholarly scientific way, and therefore that part of the problem does not appear in medical research literature. This is, of course, great news for our government. But there are many scientific studies reported in leading medical journals that convincingly show major measurable deleterious effects of inadequate continuing care by a family practitioner. Here are some of the evidence-based established facts. Many studies have shown that not having a family practitioner is associated with increased hospitalization, increased visits to the ER, increased morbidity and burden of disease, and reduced medical compliance. Now, the ultimate test of harm by a medical system or therapy or lack thereof is the death rate. It is the most finite and absolute measurement possible. The question that must be addressed is whether too few family practitioners leads to extra deaths. Now, the spoiler alert. The answer is an unequivocal yes. And ladies and gentlemen, to a degree that will astonish you. Let me describe some of this scientific research and make it relevant to our situation here in BC. One study from Northwest Ontario documented over a 9-year period an increased mortality rate in those patients over 65 admitted to hospital who had no family practitioner compared to those who had one. After discharge of the surviving patients, the death rate after 6 months was much higher in those without a family practitioner. Now, adjusting those research numbers for our different and much larger BC population, approximately 1,500 patients over the age of 65 in BC will be expected to die per year on account of having no family practitioner. Now, obviously, I agree. As a point of reference, this is a very close number to the number of patients who died per year in the first 2 years of the pandemic. Of interest, most of the deaths, both in this research group and COVID groups, were the elderly and vulnerable, the very people our own government repeatedly claimed, at least during the height of the pandemic, that they especially wanted to protect. Our entire healthcare resources were skillfully activated during COVID. By huge contrast, the deaths of the mainly old and vulnerable, but also the general public, as a consequence of having no family practitioner, gets a mere shrug from our health minister or an angry expletive from our premier. Utterly useless and quixotic supposed solutions have been foisted on we hapless voters over years, and the situation has predictably worsened by the week. Another study from the United States combined the results of many similar studies, and they estimated that 121,000 lives in America are lost because of the absence of a family doctor. When you adjust this number to BC's population size, 1,800 lives are expected to be lost because of our current situation. A remarkably similar number to the first number I quoted from a Canadian study. Now, these deaths are preventable and entirely the result of successful governments, policies, and inertia. Magisterial and shameful incompetence is what I would say. If this were a corporate, non-political situation, such deaths might well qualify for the legal definition of negligent homicide. The response by our political leaders often involves giving out misleading statements by some, and sometimes insulting our intelligence in the process. For instance, our premier on TV a couple of months ago, when announcing how important the early detection of his cancer was, advised, wait for it, that people should go to their doctor as soon as symptoms appear. Mr. Premier, 900,000 of your electors cannot do this, thanks to your government inaction. And by the way, how come your most recent budget had $0 allocated to the family practice crisis? Our Minister of Health, God bless him, repeatedly has extolled the virtues of his creation, urgent primary health care centers that will address the crisis. A Trumpian charade, if ever there was one. As a vivid example of this, I recently, a couple of weeks ago, needed an urgent prescription. I went along to the James Bay Urgent Primary Health Center 1 hour before its closing time. I was told no doctor was available. Okay, well, it's later on in the afternoon and evening. But on further inquiry, I was informed by the lady in charge, quote, "We virtually never have a doctor here." So the word for this, I think, is boondoggle. Now, to add insult to injury, just hot off the press, $780 million found by our government for a new museum, yet no money available for primary care. Just 5% of that money, if injected into the family care system, would have a major, measurable effect in saving lives. Just 5%. So to finish off, our primary health care system has truly collapsed. And the tragedy of our situation is amplified by knowing that we elected these leaders who've allowed this to happen to us. They seem neither to have the will nor the wherewithal to urgently prevent many hundreds of avoidable deaths, our deaths. Because it is our lives that are being sacrificed, our voices must rise to the occasion and deafeningly protest. We must bellow from the rooftops, unacceptable. 900,000 British Columbians surely agree with that famous Hollywood line, "We're not going to take this anymore." And And we must demand, not ask, demand immediate change. Thank you.